Okay. Our second plenary session is Fighting COVID-19 Through Evidence and Crowdsourcing. And our first speaker is Dr. Kirk Roberts, who is going to talk to us about searching for scientific evidence in a pandemic, an overview of TREC-COVID. And I'm going to let him explain to you what TREC-COVID is. Dr. Kirk Roberts is an associate professor at the School of Biomedical Informatics at the University of Texas Health Science Center at Houston. His research foci are natural language processing and information retrieval, both in application areas relevant to biomedicine. So it's my pleasure to welcome Dr. Kirk Roberts. Take it away.
Yeah, thank you. Is my screen showing up correctly, everything?
It is. We can both see and hear you.
Fantastic. I have like so many monitors in my office. I'm such a nerd, but that makes it very, very difficult for WebEx to handle. But anyway, it looks like it's working. So the first thing I need to do is make it clear I'm not claiming credit for everything here. I have sort of a team of partners in crime that participated on this project with me, and as you can see, there were several publications that came out of it. I guess for this crowd, the names you probably know are Bill Hirsch at OHSU and Dina Dimner-Fushman at NLM, but as well as some collaborators at NIST and AI2. So this was a big ensemble effort that I'm going to present. I didn't want to make it seem like I'm the only person responsible for this because it was a pretty large effort. So I shouldn't really need to convince this crowd that COVID-19 needs an evidence-based response. And there are many different demands for different types of evidence, whether it is evidence in relation to the basic biology of the SARS-CoV-2 virus, clinical treatments, as well as public health level responses. And there's certainly no shortage of supply of publications in all of these areas. It just, as a scientist, I was just blown away in early 2020 as just the whole scientific community shifted and started publishing on this topic right away in whatever their own specific subfield was. And it just, however, on the flip side, that means there's just so much information out there, and how do you actually find that information? And really that falls to the scientific field of information retrieval. You all use an information retrieval system every day. Google is one. Search engines are information retrieval applications, and really information retrieval is the study of finding relevant information in large text corpora, and that's really what scientific publications are. We still publish in natural language communication. But what really makes a pandemic, retrieving information for a pandemic different than a normal search engine? I mean, if you use Google for COVID, you especially before they put all sorts of features in to eliminate misinformation, you were certainly likely to find a lot of stuff that was not really particularly good evidence. And then we know what evidence is in terms of the scientific domain, but it's not necessarily just something that comes out of Medline or medRxiv or places like that. There are other aspects that make this difficult from an information retrieval perspective. The pandemic changes. The things that we thought in March 2020 were very, very different than the things that we thought in July and certain 2020 and then July 2021. And you would want a search engine that is trying to find evidence. Not only do you want it to find the most recent evidence, but you want it to adjust how it even conceives of this information. So, and there were quite a few search engines that people were making, largely sort of academic search engines or sort of the research arms of Google and Microsoft and Amazon. were putting out search engines, but we don't really have a good sense for how well these worked. Were they actually providing good evidence? And my partners in crime and I, we have sort of been doing some long-standing collaboration in terms of evaluating biomedical search. And so when March 2020 came around, we kind of just huddled together virtually and said, well, what can we do to evaluate search for COVID-19? And that's where we came up with TREC-COVID. So TREC is a long-standing, ever since the 1990s, platform for evaluating search engines. It's run by NIST. And so NIST sponsored this this track. There was a press release from NIST and the White House Office of Scientific Technology Policy announcing TREC-COVID. We had some funding from NIH and Allen Institute of AI, as well as Microsoft, to help us do this. And really, most of these TREC-style challenges can be seen from two different perspectives. From one perspective, especially the perspective of the participants who are entering their search engine into this competition, is they think of it as a competition. They want to have the best search engine. They want to say, our search engine retrieves the best evidence for COVID. But on the flip side, and most of the organizers, we think of it really as not just the current participants in the competition, but really as a way to build a data set so that anyone, whether they're a participant or not, can have a benchmark for tuning a search engine for COVID-19. And I won't cover it here, but there's been a lot of publications since on COVID-19 search that have based their evaluation on the data set that we produced from this challenge. So when this is the outline, a lot of things I want to cover. I guess I should state that when you submit an abstract, it's real easy to sort of overpromise a lot of things. And I think probably my to quote Top Gun, my ego wrote a check my body can't cash. So my slides do indeed cover all these different issues, but for the sake of time, I'll probably need to sort of skim through some of them pretty quickly. The overall structure of the competition was actually, normally we just do a single round where we just release some topics, participants run those topics through their search engines, they submit results, and then we judge them, and just sort of a one-off task. But since this is, as I mentioned, the pandemic is evolving, we can see this as more of a multi-round structure where there are actually 5 different rounds, and each round, as time goes on, the amount of data that's available increases, the number of things that people are searching about increase, and also we have more time to manually judge some results. So the size of the benchmark data set increases as well. So it gets sort of, as you go on, it just gets bigger and bigger and bigger. We started with 30 topics, and I'll show you a couple examples on the next slide. But every round we added 5 new topics, and we tried to make them relevant to the whatever the hot stuff was in the pandemic since the last time we released topics. So there was a clinical trials about a new treatment for COVID, so we made sure we threw in a topic about that, stuff like that. And we really tried to balance questions about basic biology, clinical science, and public health. And the topics had different levels of granularity simply because search engines sometimes need that, and probably just best to just show you some examples. This is the first one. It was a round 1 topic, and essentially, what are the best practices in hospitals and at home in maintaining quarantine? And participants could use, their system would use it automatically. It could use either any of these three aspects of the topic. Obviously, the question and the narrative sort of increasing levels of granularity, whereas the query looks a little bit more like the type of thing that people would actually submit to something like Google. But if you give a search engine more information on what you're looking for, it should be able to provide better results. So the actual data set, luckily Chris Lehman introduced the notion of a corpus, but this is, in our case, the corpus for this, what we're searching across is the COVID open research data set, or CORD-19. This has been used in a ton of other NLP papers and such, and it's from the Allen Institute of AI, and they gathered this. This is a prior effort that we sort of latched onto, but luckily the CORD researchers participated in our track. This data set has information from PubMed, PubMed Central, a whole bunch of preprints, and other databases. So they pulled in an awful lot of information on CORD-19 that could be searched across. And because we had a round structure, we had official snapshots of CORD-19 for each round as it grew larger. And I think ultimately CORD-19 started having daily updates. It just that was the rate of new information that was available. So I have a table on the right of every team that participated. I had to make it pretty small because there were a total of 92 teams that participated at some point in the TREC-COVID challenge. The participation at round one was the highest, as sort of everyone was excited, and then as I think people realized that they were nowhere near the top rank in performance, they sort of maybe the lesser teams sort of dropped off, but we still had pretty high levels of performance, high levels of participation throughout. So it was really tremendous, actually. From the round one was April 2020, so it was I think they had from like my initial tweet that we were going to do something until the deadline for round one was like 3 weeks to build a whole brand new search engine on a data set that many of them had not actually used before. So that's really remarkable level of participation, that many people were interested. And these are mostly people that, what they do is they're, academics or industry researchers, and they build search engines for a living. And so this was kind of their way of participating in the response to the pandemic. I'll skip largely over the notion of pooling, but we essentially we wait for participants to submit their results, essentially what they think are the top ranked results for each topic from their search engine, and we actually use that to determine what we are going to manually evaluate. And each result, it gets essentially a scale, either a single, essentially it's a single paper for a single topic. That paper is relevant for that topic, so it means it's fully responsive. It might be partially relevant, which means that it might have just part of the answer for what that topic is seeking, or it's just not relevant at all. And there were 67 people that participated in the manual evaluation of this. And this is this is remarkable to me because it's a fairly boring thing to actually just go one by one through papers and say this paper is relevant or not relevant for this particular topic. But 67 different people did. I mentioned NIH, and the NIH's real contribution was that Patty Brennan at NLM told her Medline indexers that they could participate instead of doing their normal Medline mesh indexing. They could take part of their time and dedicate it to this task, which was fantastic. And we also paid some medical students and recent medical students to judge as well. They had this sort of interface that made it easy, where there's all the documents and they can sort of go through, and there's the topic at the top, and there's the article that was retrieved by at least one of the participants, and they could mark it as relevant or partially relevant. So it was a fairly efficient way of annotating the relevance information. And let's see, I'll just skip to the results. There are a lot of metrics that we use in information retrieval, and I won't bore you with the details of all of them. I think most people here are probably just interested in, how well did these search engines that people built, sometimes very, very quickly, to find evidence for COVID-19 related questions, how well did they work? And again, there are a lot of metrics, but I'll sort of call your attention to the column that says P at 5. So P at 5 is precision at rank 5, which is to say that the top 5 results that the search engine retrieves, if you're using Google, it's basically like what's literally just on your screen that you can see as a result of your Google query, and what percentage of those are relevant. And the top rank system, which is the Sabre system, at round 1, it had 78% of the top 5 results were relevant for a topic, which is having done biomedical retrieval evaluation for a long time, 78% is really, really remarkable. And by round 2, the systems were getting even better. So, I think there's not really too much differences as you sort of go down individual teams. But I think that the overall point here is that many of the participants created really excellent search engines. And I have another paper where my student sort of evaluated this top search engine against the public-facing search engines that Google and Amazon put out. And the public-facing ones weren't nearly as good, but there were some lessons learned there, and I don't really have time to go too deep into it, but it's still pretty remarkable just how well some of these methods performed. And I'll just to give you a sense for sort of the difficulty of topics, don't worry too much about the actual scores here. AP is average precision. It's one of the metrics we use. But you can kind of get a sense for, do all topics perform equal, or are there some that are just really easy and some that are really hard? What you can tell from this graph here is that it's sort of a pretty consistent downward slope in terms of, there are the easy topics, and they're just, slowly goes down to some that are really hard. So it's not like there's 10 topics that no one can do anything on, and the other 40 are just easy and gimme topics. It's really a gradual increase in difficulty, and therefore a gradual decrease in scores across these topics. And that's sort of what you want to see in a good evaluation. So just the overall lessons learned here. Our primary goal was really to build a pandemic test collection, and so we succeeded there. It's not really it's not necessarily a major. We sort of knew we could do it, although there were a lot of nights and weekends that I spent organizing and coordinating with the 67 different assessors to try to make that happen. So it was a lot of work. It was nice to see it actually got done. There were from the information retrieval community, there were maybe some holes in the evaluation, but at the end of the day, we were operating in a time span that we're just not normally used to doing. Again, we're normally used to have one round, and we have months to do and evaluate, to assess all the results. And now, because of the multi-round structure and because of the speed of the pandemic, we had, we took in results, and we had like a week and a half to actually judge them. And so, as you can imagine, we didn't get the depth of judging that we would normally do. But it ultimately ended up working out well fine. We wrote another paper on just sort of assessing the quality of the data set, and it turned out that despite these limitations, it's a pretty high quality data set. And I mean, part of the reason that it did work out is just how much the scientific community really focused on COVID research. They're just, you know, there were just, every single topic had some relevant information for it, which is, I mean, that's not thanks to us, that's thanks to the scientific community for just covering all sorts of different things. It would have been nice to have even more topics, you know, certainly some more granular topics. As you could see from those examples I provided, they were fairly high level. They might have been more high level than you would normally sort of expect most people to actually create search queries on, but we were trying to get you know, a broad coverage of the types of things that people were interested in. And you know, in terms of one of the real things we were looking for is, you know, how to handle a rapidly growing scientific corpus in response to the pandemic. And this one we are still sort of flummoxed on exactly what needs to happen. We, you know, so if we, you know, hopefully there's not a new pandemic anytime soon, because we're still sort of thinking through how exactly do we deal with this particular issue. You know, we added, for instance, we added 5 topics every round, which basically was like 5 topics every 3 weeks. And it just turned out that, you know, the pandemic evolved so quickly that 5 new topics was nothing compared to all the things that were coming out over the course of 3 weeks. And, you know, one of the things we were really interested in, because, you know, you have to build a search engine so quickly, is you don't really have a lot of resources to build it with. And so you need to, you know, all these fancy machine learning methods that people use nowadays to build search engines, you just don't have much data to train them on right out of the gate. And as I showed you the round 1, the top search engine, which is from Sabre, it's a system known as SMART. This was a system that was designed in like the 1980s. I think it was designed in the 1960s, but implemented in the 1980s. And so it was a very, you know, it was a very simple system that won round 1 and not machine learning based at all. But by the time round 3 comes around, there's a lot more data that we've produced. People can train machine learning models. And so more, you know, state-of-the-art machine learning methods are able to actually to win, you know, those particular rounds. So it took a while to actually be able to have use the latest and greatest methods in information retrieval to outperform sort of, you know, a 1980s search engine. You know, we created different, you know, there are different ways of sort of viewing this data and different ways of viewing the data sets that we could create from it based on whether you care about evaluating a search engine at different states in the pandemic, or whether you just sort of want to have an overall notion of it. And so we created, you know, different data sets. I want to leave some time for questions, so I won't really cover them, but you know, different things you can train on and different things you would test on. And I'm happy to sort of answer more questions about that offline in case anyone was interested. So in conclusion, this ended up being, with 92 participants, the most popular TREC track of all time. I mean, TREC goes back to the 1990s, and to say it's the most popular TREC track of all time when teams only had a few weeks to implement a system, that's impressive. Not impressive to me, not impressive that anything I did, or but really just impressive that the response of the scientific community. And despite some of the issues we had, it's a very you know, large data set and collection we had. It's driven a lot of information retrieval research in COVID-19. There's certainly a lot of publications since the task completed that have used it. And you know, hopefully this gives us some idea of how we can build these search engines and the next time a pandemic comes around. So that's all I have. I'm happy to take any questions. In case our moderator has gotten her mic to work.
We don't have any questions in the chat yet. Here's Susan and Gabriela. Gabriela, you want to give it another try?
Unfortunately, I think we're still having technical difficulties. We still can't hear you.
Okay, we just received a question in the chat. Can you please explain P at 5 a little more? Can we encourage our patients to utilize some of these features? What makes topics hard?
Okay. So P at 5 is, again, if you essentially just, you think about when you type in some keywords for a Google query and you see a list of results that come back, right? P at 5 is basically you look at the top 5 results from the search engine and just say, what percentage of these 5 are relevant? And so if you have a P at 5 of 0.8, that means that 4 out of the 5 were considered relevant or not. And typically, for biomedical search engines, like if you use PubMed, on PubMed, PubMed's relevance ranking has a precision of 5 at like 0.2 or something, where you oftentimes have to look very far down the list and look through a lot of results to find something that's relevant. And then in terms of what makes topics hard, there's a lot of information. There's several things that go into making a topic difficult. The biggest issue is there a lot of information in the data set for that particular topic? If there's not, if there's only, in all of the data set, there's only 5 documents that are relevant for a particular topic, and there are 60,000, papers in the data set, then, it's going to be hard to find those 5 oftentimes. So having more relevant information certainly makes a topic easier. And the other thing that makes it hard is the words that are used to express the query, the topic, might not be the same words that we actually see in the paper. An easy example would be, if you go back to like January 2020, or I forget when the official designation COVID-19 came out, but any paper that was published prior to that official declaration that we're calling this thing COVID-19, it had different terminology that actually described, it was a common thing was 2019-NCOV, which is sort of the 2019 novel coronavirus. And there were other types of terminology that people used. So when people don't always use the same words to describe the same thing, and I think everyone here has probably had the frustration of searching for something on Google or Bing or whatever, and nothing's useful has come up, and so we've had to like play with the query a bit to try to find something that actually gave back useful results. In an ideal search engine, you shouldn't have to do that. In an ideal search engine, it should be able to infer the underlying intent behind what you're interested in. That would, but it's obviously hard to do. That takes a lot of AI, and so the harder it is to infer, oftentimes the harder the topic is.
Okay, thank you very much, Kirk. And we are out of time. Dr. Wilson, do you want to try your audio again one more time?
One more time. Can you hear me?
Yay, yes.
Wow, this is amazing, right?
All right, I will turn it over to you.
Well, thank you so much, Susan, for saving me. Well, I wish now we were all in person. So, technology is great, but sometimes gives us headaches. So we could see that with my audio today. I want to just introduce myself. Gabriela Wilson. I'm a professor and co-director of the Multi-Interprofessional Center for Health Informatics at the University of Texas at Arlington. And I'm super excited to introduce our second speaker, Dr. Sameh Saleh, who will share with us a presentation titled Early Crowdfunding's Response to the COVID Pandemic, a Cross-sectional Study. A little bit of information. Dr. Saleh is internal medicine physician and healthcare data scientist, a clinical informaticist with a background in computer science. He has extensive experience in both academic and industry applications of machine learning and predictive analytics in healthcare. Dr. Saleh is a member of the Clinical Informatics Center at UT Southwestern and recently began his Clinical Informatics Fellowship at Children's Hospital of Philadelphia. Dr. Saleh, welcome, and we look forward to your presentation.
Hello. Hello, everyone. Can everyone see my screen?
Yes, your screen looks great.
Okay. Awesome. So thanks so much, Dr. Wilson, for that introduction, and thank you for the opportunity to present at this inaugural THIA conference. So today I'll be talking about the early crowdfunding response to the COVID-19 pandemic. And I wanted to direct you to the QR codes here on the screen. So on the left, in the blue QR code is a link to the manuscript that was published in JMIR earlier this year. And then on the right in orange is the QR code for my website that has links to different ways to contact. And I'll have that at the end of the slides as well. I'm not sure what just happened. Sorry about that.
That looks great.
Looks okay?
Yes.
Okay, thanks so much. So yeah, no disclosures to report at the moment. And I just wanted to set forth the agenda for today. So I'll just start by setting up, what is crowdfunding, just to have us all on the same page, and talk about why it's a big deal, especially in the context of medical crowdfunding and healthcare for this audience. And then I'll use, some of our previous work, introducing it to help set that question up. And I'll discuss then the crowdfunding response in the early stages of the COVID-19 pandemic. I'll introduce both our methods and our results for that work. And then I'll dive into some of the exploratory work that was inspired by that crowdfunding response to COVID, looking at the relationship between crowdfunding and healthcare crises or other public health disasters. And then lastly, I'll just summarize by talking about some of the takeaways and future directions and limitations of our work. So just starting in, what is crowdfunding? So simply, it's the online solicitation of public funds. And typically an individual or an entity, they post a campaign online, and that may include text and they may include media. And they're basically asking a large number of people to provide small investments or donations to reach some goal amount. And here at the bottom is a sample template of a campaign for GoFundMe, which I'll be talking a lot about during this talk. And you'll see on the left, just to remove any personal information, just included what they would look like. You'd have a title at the top, some photos, and then some description. And on the right, you have all the campaign information, like the goal amount desired, the amount raised, number of donors, number of Facebook shares, the individual donations, etc. And there are different types of crowdfunding, some that you guys may have heard of. We won't focus as much on the equity-based or reward-based, but I'll just briefly go through them. These are typically, you have some return on your investment or some return on amount you as an individual might contribute. So equity-based, you're basically getting some equity in a company in return for your investment. And then reward-based is if the crowdfunding campaign's a success, you might get a reward or a product or a service that you're crowdfunding for. And I show at the bottom the most successful crowdfunding campaigns for each of these. So Brewdog is actually a brewery in the UK that raised over $100 million this way, and a little over 50% of their companies publicly owned through this method. And then reward-based, you guys may have heard of Kickstarter or Indiegogo. The most popular campaign over time is the Pebble Time Watch from 2015, raising over $20 million. And then what we'll be focusing mainly for the rest of the talk is donation-based crowdfunding. And the most popular of which, and probably most well known, is GoFundMe. And the most successful campaign over time is very recent, actually, the America's Food Fund, which was raising funds to feed neighbors in the COVID pandemic, raising over $44 million. The one thing I'll add about donation-based funding is, kind of as it implies, you're donating money, you're not expecting anything in return. And this is the type of personal or social crowdfunding that we're going to be talking about other names for. So now that we have a little bit of familiarity with what crowdfunding is, just want to set up why it's a big deal, especially for medical context or healthcare context, both by talking about the growth of crowdfunding over time and by talking about the impact using some of our previous work. So in terms of the growth, about a third of all of these personal campaigns or social or donation-based campaigns intend to pay for healthcare costs directly. And those numbers have increased significantly over time. We're talking from about $1.6 million a year in 2011 to $150 million in 2014, $650 million in 2016, and then over the last few years, it's estimated to be over a couple $2 billion per year. As mentioned before, most of these, the market share is controlled by GoFundMe. It's estimated about 90% of that market share in the United States is under GoFundMe. So we talked about the growth, now focusing on the impact, and I wanted to look at some of our previous work that might give some context for that. And at the bottom left is that QR code for the manuscript in JAMA Network open if you guys are interested. So we explored the question, why do individuals from Canada, the UK, and the US turn to medical crowdfunding, and what factors are associated with funding success? So we looked at a little under 3,400 campaigns on GoFundMe between March 2018 and February 2019. And there were about an even number of campaigns, a little over 1,000 for those three countries. And I'll focus on just a couple main takeaways of this work. The first one is that we found a fundraising disadvantage, both in terms of the number of campaigns initiated or the proportion of campaigns initiated, and the amount raised actually once a campaign was initiated for these particular subgroups for female gender, Black race, routine care. So that was one main takeaway. And then the second takeaway is when we looked at campaigns primarily for treatment, so that from the previous slide, about 33% of campaigns, we found a pretty big discrepancy about what the type of treatment that was being crowdfunding for in the different countries. So focusing on that fourth column, you'll see that the US, nearly about 80% of campaigns are raising money primarily for routine care, as opposed to 20 to 25% for the UK and Canada. And you contrast that to those the experimental group and the approved but non-accessible group. Those tended to skew more towards Canada and the UK and less towards the US. So, the main findings here suggest that there are important differences in the reasons of medical crowdfunding across these different healthcare systems, and that there are evidence of racial and gender disparities in crowdfunding success, which will be important to think about as we talk more throughout this talk. And then we actually wanted to build a little bit on this previous work by looking at a broader set of all campaigns available on GoFundMe, all medical campaigns available on GoFundMe. So again, you can access this presentation that was done at AMEA last year from the bottom left corner. But we wanted to explore how uninsurance rate and medical crowdfunding success relate by state in the US. So we looked at a little over 120,000 medical campaigns, also on GoFundMe between September 2018 and August 2019. And only about 11% of all of these campaigns met their funding goal, and most of them had less than 50% of their goal funded at all. I distilled down to just this figure in the middle because I think it provides an important takeaway. And also, the figure on the left, figure A, shows the median percent funded per campaign by state. So put it in perspective, the lowest median percent funded is in the neighborhood of about 20%, and the highest about 45%, showed in dark green. And you'll see that those that had higher percent funded tended to be in the Northeast and some in the Midwest. And then you contrast that to the uninsured rate by state, which is ranging from about 3% to 17%, and higher uninsured rates tending to be more in the South. And what's interesting is just visually that these are almost mirror opposites of each other. And while there needs to be more analysis to kind of explore some of these differences and relate these things together a little bit more, what this suggests is that medical crowdfunding may not actually bridge gaps in healthcare coverage, but may actually further malign those that lack insurance at all. So, so we talked about a little bit of medical crowdfunding, the growth and the impact of it. And in the earlier stages of the COVID pandemic, wanted to explore more about how crowdfunding was being used. I won't belabor the point of going through what happened at the beginning of the COVID-19 pandemic. We all lived through it. We all experienced it. We all saw the health impacts, economic impacts, especially early on. And there were anecdotal reports of the increased use of crowdfunding, but it really wasn't studied in any systematic way. So we had a couple of hypotheses around this question. So we hypothesized that COVID-related campaigns, as opposed to non-COVID related campaigns, raised more money and were shared more broadly and successfully in the early stages of the COVID-19 pandemic. And we hypothesized, number two, that COVID-19 related campaigns were disproportionately started or initiated in those first days and weeks of the pandemic, and it wasn't really related ultimately to the rate of incident COVID cases. So jumping into the overview of methods. So the study population that we looked at was all available US campaigns across all categories on GoFundMe between January 1st to May 10th, 2020. And the reason we looked at those dates was it's approximately 2 months before and after the WHO declared COVID-19 as a pandemic on March 11th, so that we can kind of contrast how things have changed before and after that major event. And we used a web scraping tool through Beautiful Soup through Python to web scrape all the data available on campaigns so that we can get more insight about that change. We then stratified the different campaigns as COVID related versus non-COVID related using keyword matching, keywords relevant to the COVID-19 pandemic. So things like COVID-19, SARS-CoV-2, NCOV-19 pretty early on, the word pandemic itself, things like that. And then a lot of the analyses were more exploratory, seeing some of the trends over time. So we looked at weekly COVID-related campaigns in relation to weekly new COVID cases, both on a national level and then on a state level. We looked at COVID-related campaigns per million inhabitants for each state over time. We looked at COVID-related campaigns per million for each category on GoFundMe over time to see how people use different categories in the COVID pandemic. And then to further explore this, we used a natural language processing technique to identify keyword clusters of campaign text with the goal of basically seeing if there are themes that pop out in addition to the categories that are chosen by the campaigner. So just briefly, for the natural language processing side, to look at those trends, we used a method called term frequency inverse document frequency, TF-IDF, which you can think of generally as looking at the originality of a keyword or a word for a particular document. So you're comparing the number of times a word appears in a document, or in this case a campaign, with the number of documents or campaigns that the word appears in. And this returns a matrix of values. So the word "the," for example, will pop up in a lot of campaigns all over the case through different campaigns, but that wouldn't score highly. It wouldn't be high in the TF-IDF, as opposed to a word that might be more unique, like PPE or healthcare, for example. And then using this matrix of values, we used k-means clustering to identify clusters of themes. And we picked a priori 20 clusters given that there were 20 categories that can be chosen on GoFundMe, looking at how these keywords can cluster together. So we looked at a little under 233,000 U.S. medical campaigns across all categories and the dates specified. And of those, about 52,000 were COVID-related campaigns, representing $237 million to date at the time of the analysis. And then we, this figure is looking at how the new GoFundMe campaigns developed by week versus new COVID cases by week. So you'll see a very clear-cut spike in the number of COVID-related campaigns that started around the March 9th, March 16th, March 23rd week. And that increase in crowdfunding in that interval was all related to COVID-19. What's interesting, though, is that spike in COVID-related campaigns in March 16th and 23rd was actually before spikes of cases within the U.S. And that response with COVID-related campaigns didn't maintain over time, despite cases continuing to increase over time. So we then explored the data in another way. So we looked here at the COVID-related campaigns per million inhabitants each week by state. So at the bottom on the x-axis is the date that the campaign was created. And on the y-axis is the number of campaigns created per million inhabitants. And all 50 states are shown here, but only the top 6 states are shown in color. And then for the US, that's shown in the black dashed line. So as you can see, almost across the board for all states, but especially for those top states, there was a very clear peak around the March 16th to 23rd weeks that significantly decreased over time. This is exploring the data in a different way, looking at COVID-related campaigns per 1,000 COVID incident cases for each week. Again, we show those top 6 states from the previous graph. And on the x-axis, we show the weeks. Week 0 represents the first week that a state had 100 new COVID cases, so that all comparison between states is valid. And the x-axis shows those weeks over time. And then the y-axis shows the COVID-19 campaigns per 1,000 incident COVID cases. And again, you can see after those first 2 weeks, consistently, most of the states had a significant decrease in the number of campaigns they were creating per COVID case. So then we wanted to compare directly how well do COVID related campaigns versus non-related campaigns, how well do they do and how do they compare to each other? And we only used campaigns after March 11th, so that we're looking at the same time period. So I'll just start by section here, starting with the fundraising section. You'll see across the board, COVID-related campaigns were asking for more money or a higher goal. They were raising more money. They were meeting more of their goal or more of their percent funded. They had more donors and they had more amount per donation. And those trends mirrored some of the campaign information as well. There were more of those campaigns for COVID-related campaigns listed as charities, and more of them had longer descriptions or longer narratives and a lot more Facebook shares. And I won't delve into this section as much, but the campaign categories, there were some differences there that might be expected, where COVID-related campaigns were proportionally more likely to be under the accident and emergency category or the medical illness and healing, the business section or the community section. Less likely to be under sections like animal and pets, etc. So we looked at some of the variations of COVID related campaigns by state. This is looking at the COVID related campaigns by category that are listed. So some of the interesting trends here is where the peaks happen for these different types of categories. So in the blue line, we'll see that the first peak happened around March 16th, the week of March 16th, focusing on accidents and emergencies. And then the next peak in orange and red focused more on the business side of things and the community side of things. After that, the black peak is about medical illness and healing. And then lower down in green, you see a kind of delayed peak in funerals and memorials in the early stages of the pandemic. So, you know, we explored the different categories over time, but this is also exploring how those themes that are through natural language processing techniques, how those can relate. And I only show the top 10 here of the 20 clusters that were formed just in terms of space, but these are ordered by the number of campaigns that fit in each cluster. And a lot of these clusters fit with some of the categories that would be expected. So the larger cluster 0 is about community support, fundraising for school and children in the time of need. There are multiple clusters about healthcare workers. One of the ones that is included here is cluster 7, talking about healthcare workers, PPE, supplies, things like that. There's some clusters about small businesses and jobs that popped up pretty frequently in clusters 3, 5, and 6, as well as 9. And then a cluster, for example, for funerals and memorials in cluster 8. So a lot of this initial work with looking at the crowdfunding response, it was very interesting to see that initial response on a crowdfunding platform to COVID, and then that decreased response over time. So that got us thinking and exploring other emergencies that have come up in that same interval, natural disasters, health emergencies, things like that. And what we found is that there was an almost immediate response of increase of GoFundMe campaigns right after certain disasters. So we show 3 examples here of communities in distress at different geographic granularities, and the trends kind of hold across these different geographies. So we see an immediate spike in campaigns in Puerto Rico after the earthquake on January 6 and 7 in 2020, a spike after the tornado in March in Nashville, and a spike in the tornadoes in Mississippi in April of 2020. So this is still part of that initial exploratory work that raises an interesting area of research where we can explore how crowdfunding may actually function more as a weather vane for community in distress, and might give some interesting insights into the emerging needs of a community as these natural disasters or health emergencies might arise. So jumping into some of the takeaways and future directions, did want to start a little bit with limitations first. You know, we talked about GoFundMe a lot through this talk. That is a single crowdfunding platform. Even though it has 90% market share, there's possibility for some selection bias there. Second, and I think is an important point, is the limited scope of crowdfunding. So, you know, only a subset of the population that has unmet financial need will actually be represented in crowdfunding, because there's still an element of requiring access to technical and social resources, either in order to create and coordinate a campaign on your own, or to have someone in your community that can actually fulfill that role. The third, there's because of the large number of campaigns, we're actually unable to validate that the campaigns used for COVID-related campaigns were indeed designed to mitigate the effects of COVID-19. And then the last is the need for more longitudinal analyses. So this work was initially just focused on that earlier response, but obviously so many things have happened in the interval in terms of variations by geographies, new strains, changes in economics over time. So definitely need some more longitudinal studies. So the main takeaways for the group, first is, you know, crowdfunding leverages a public reaction early in a public health emergency, such as the COVID-19 pandemic. We saw that. Likely the novelty of the emergency impacts both the rate of how campaigns are initiated and which crowdfunding campaigns actually succeed. Third is that crowdfunding appears to be a stopgap for only a minority of campaigners. Most campaigns don't actually get fully funded, or not even majorly funded, and there's opportunity for actually worsening some healthcare equities in that process. And then last, some of the exploratory stuff is that crowdfunding activity may actually provide an early signal of emerging needs and societal sentiment of communities in acute distress. I wanted to thank the group. I know Chris has mentioned a lot of the work that we've done as a group with Chris and Richard under the Clinical Informatics Center around natural language processing, social media, crowdfunding. I appreciate all the the support in that process. And again, my contact information, the QR code in the bottom left. You can please feel free to email me to Southwestern or the Penn Medicine email, or reach me out on Twitter. Thanks so much.
Dr. Saleh, that was a wonderful presentation and very interesting. I don't think too many people look at this topic, and especially how it relates to COVID-19. So thank you for enlightening us. Do we have any questions in the chat? If not, I have one for you.
We do have a question in the chat. It says, is this study ongoing? For example, compare annual trends and develop other variables to this hypothesis.
Yeah, that's a great question. That's the goal. So we actually have data over the last year and a half or so. We haven't gotten to the point where we've fully analyzed and processed it, but completely agree that there's so much that's happened over time in the course of the pandemic that there are a lot of variables that can play in this hypothesis. This is more hypothesis generating and exploratory at this phase.
And I do have a question too. Have you looked at the medical crowdfunding to see, looking at the states that you presented, to look at the demographics of the state and also the socioeconomic status of those, or social determinants of health even at the state level, if there is any difference? Some states might have different composition in terms of race, ethnicity. Do you see any difference?
And sorry, Dr. Wilson, I think it was initially cutting up a little bit on my end, so I didn't hear the full question, but what I heard was focus.
Can you hear me?
I can hear you. It sounds like you're asking about variations in demographics and social determinants of health by state and how that plays a role. For sure. So something that we've looked in, still in the initial phases, is the American Community Survey that has a lot of information, further information about social determinants of health, some more demographic information, and we've explored incorporating that in this work, but still in the earlier phases of that as well.
Thank you. Are there other questions in the chat?
So just one more question, which is, are you the Twitter warrior that we need to follow? And I think, yes, we do. That was the last question in the chat.
It's still cutting up on my end, so I can hear the full thing.
Oh, I'm sorry. It said,
chat,
are you the Twitter warrior that we need to follow? And I said, yes.
Absolutely. As well as our conference.
Yeah, I'd love to follow. Exactly. And I'll follow you back and try to increase support for each other.
Well, thank you so much. That was wonderful. If we don't have any other questions, Catherine, I will let you get us ready for the lunch break.